So ESMO sarcoma and rare cancers, 2023, it was the first meeting organized in this format by ESMO, and brought the attention of more than 600 participants, more for sarcomas, but also for other rare cancers, like, for example, ocular melanoma, which is also my focus of interest. It was a perfect presentation by Sophie Piperno-Neumann about the new approaches in this rare type of cancer, which had gained some improvement with introduction of new kind of therapy with B-specific receptor, tebentafusp, with improvement of median overall survival about half a year. It was also the first presentation of new ESMO recommendation for Merkel cell carcinoma, which is very interesting because it is a rare but very aggressive type of the tumors and should be treated with European Reference Network for solid tumors. In terms of sarcomas, there were several interesting presentations, some, for example, regarding MDM2 inhibitors in liposarcomas with MDM2 alterations. In this type of sarcoma, new MDM2 inhibitors seems to be very effective. So it's we can expect that such approach will be soon available in routine practice. Moreover, at least representation, which has been also highlighted in ESMO report, Daily Reporter, that there are huge delays and poor patient journeys in countries at different level of healthcare system, and awareness campaigns and healthcare service reorganization can improve rare cancer management in more developed areas. Some presentation from, for example, from our center, we presented the data that pandemia, even in high volume center, reference center, caused the increase of more advanced tumors. We compared the data of adult bone sarcomas patients treated during the pandemic and before the pandemic, so pre-pandemic times, 2016, 2019. We compared more than 300 patients altogether, and patients treated during the pandemic times had lower rate on limb-sparing surgery compared to those treated during the 3 years before pandemia. So it's it has been especially seen in high-grade malignancies. Tumors were generally larger, and limb-sparing surgery was significantly lower. The comparison was between 54% and 78%. There were also some presentation about basic science. For example, the group from my center, working together with colleagues from Memorial Sloan Kettering Cancer Center, New York, evaluated EZH2 mutation, which were found in 6 of 200 patients with Ewing sarcomas. What is important, because it is a very small group of Ewing sarcoma patients, but with aggressive phenotype, and they can be vulnerable to inhibitors like tazemetostat. So it's important approach, because we try to find, even in rare cancers, the subtypes of the tumors which can be targetable with new drugs. Thank you very much.